morning, everybody. My name is Dr. Dana. I am the owner of Ask Pediatrics, which is a local pediatric office here in Tallahassee. So I know that we're talking about a lot of things today that are very important and that specifically affect the Black community. I wanted to take some time to talk about teen depression. So we are really in a modern day epidemic at this time. um, Especially during COVID and at the height of COVID. In my office, we routinely do mental health screenings. So yes, we check the eyes, the ears, make sure the muscles work. But we also in teens start asking about depression, anxiety. We ask about sexual activity. We ask about drug usage. We ask about alcohol usage as well. And what I started noticing is that especially at the height of the pandemic, teens were depressed. A lot of teens were contemplating suicide much more than their parents and their friends and anybody else knew. And so it has still kind of continued. And because we tend to not see it and react to it as a community, I'm just trying to talk about it so that you guys at least know what the warning signs are. So what I'm going to do today is talk about adolescence so that you know what the stages are. I'm then going to talk about the stages of depression. Adolescence is a fluctuant time. There are a lot of strange things happening to teens. So I want you to be able to identify what is normal for adolescence and then what may be depression. And then we're going to talk about treatment options and things that you can do as parents and educators and friends. So in 2021, the CDC did a study on youth mental health surveillance. And what they ended up finding was that 4 in 10 students felt persistently sad or hopeless. Nearly 1/3 experienced poor mental health. In 2021, 1 in 5 students seriously considered suicide. And 1 in 10 actually attempted suicide. So these feelings were found to be really overall across a lot of groups, but the ones that they were more prevalent in were females, LGBTQ patients or students, and students across racial and ethnic groups. But it must be said that Black students were more likely to attempt suicide than other students than any other race or ethnicity. And I want to say that again. Black students were more likely to attempt suicide more than students of any other race or ethnicity. The reason why this is so important is because as a healthcare professional, when I'm doing my screening and I'm talking to my patient and I find out that there's an issue and I go to the parent or I'm going to mental health professionals, I feel like no one's listening. And at the same time, I'm talking to my patient who's telling me that they have a plan. They're not seen and they're not heard. I don't know why. And so at least what I'm trying to do today is to get it through to you all so that if you see somebody, you can say something and you can help me do something. Now we're going to go through the normal stages of adolescence. And again, like I said, I have pictures of all different stages so you can see, and we'll get into this a little more. So early adolescence. So a lot of times we think teenage years start at 13. That is technically true, but it isn't, right? So we know early adolescence starts at 11. So I have a lot of parents coming in, they have 10-year-olds, 11-year-olds. They don't understand why they're doing the things they're doing because they're expecting to see this behavior at 13. What I'm here to say is a lot of this stuff is normal, so we're going to talk about it a little bit more. The first thing that you'll start to note in your child or in a family member is they're going to have concrete thinking. So what that means is everything's at extremes. Everything's either really good or really bad. You're either really right or really wrong. They just may be more moody. And it's hard because, as you've been talking to this child who's been growing up, they've been more accepting, maybe going along with things, and now they're starting to push back a little, and you're going, what's wrong? Just kind of calm down. But this is actually a normal stage. The other thing that you'll notice is that they have egocentrism. So what does that mean? It means that kids are going to start being more self-conscious. So what it means is if you're pulling up to school now, let's say if you're playing music, your early adolescent is going to tell you to turn everything down. Or if you're speaking too loud, you're speaking too loudly. What they're going to start feeling like is that the world is looking at them and they're going to be more self-conscious. So it's just something to note. You can still kind of give them reassurance that this is completely normal. They're often self-conscious about their appearance. And during this time, they need positive reassurance. Why? Because their bodies are changing. They may feel awkward in their bodies. They may not want to talk about certain things. But what I would even say as a parent, as an educator, just keep giving that positive reassurance. And it's hard sometimes. I even notice myself, I get really critical with my child at times, but then I realize I have to back off because I can say some things, but I also have to counter it with positive things because he's growing in his body, everyone's growing in their body, and sometimes it's just really awkward. So just positive encouragement so that they know that this is a natural process. You may also notice that there's a need for privacy. So the child that may have been with the family playing and hanging out and talking may now stay more in their room. They may not come out as much. This is okay. I know a lot of times this triggers a stress response in parents. And so what do? They go full court press, right? They want to know what their child's doing, why they're doing it, what's going on. This is normal. You really want to give them a healthy dose of distance so that they have their privacy, but they will still come back and talk with you and hang out with you. So this is normal. Now we're going to get to the middle adolescent age, which is 14 to 17. So at this age, kids become very concerned with their appearance. So even though you have an early adolescent that may be more self-conscious, now it's even stronger. Peer pressure also may peak at this age because friends start becoming more central to their identity and to their existence. So the child that was more family focused, you may find is now going to friends, talking to friends. And this is also hard for parents because for parents that especially think that they have that strong bond with their kids, you still do have that strong bond with your kids. It's just that now kids are looking to their friends as well for advice. Their frontal lobes are still continuing to develop. So this can also be annoyance too, where you're looking at your middle adolescent and saying, why are you doing those things? That doesn't make sense. The thing is that their frontal lobes really don't start maturing until they're 20 years of age. So what that means is that their executive functioning, their decision making, right, their impulse control, they don't know about consequences and they don't really think about the consequences of situations. That all comes into play. So even though kids do things at this age, you have to give them a little bit of grace. Now, they tend to think abstractly and consider the big picture. So what that means is they don't really think about the consequences of their actions. So let's say if you have an adolescent who's like, hey, I'm really great at math, but I really want to go to that movie tonight with my friends. So I know I have a test tomorrow, but I don't really need to study. I'll be good. They don't really think about the consequences of not studying for that exam. And again, strong emotions continue to drive the decision making all the time. This may be frustrating to you as a parent or an educator because you're just trying to talk to the child and maybe they go into histrionics or they get very angry or they start crying. It's a lot. It's stressful. So a lot of parents tend to back off. It can be a very stressful and isolating time for both parents and kids as well. Now, at this time, middle adolescents are also interested in romantic and sexual relationships, okay? They're also more focused on that one-to-one relationship. So you may have a child who was in a group setting, they used to hang out with friends, who now has a significant other. At this time, they also may explore and question their sexual identity. I need everybody to realize that this is a normal stage. I have gotten too many calls of parents screaming into the phone about catching a child masturbating. It has to be talked about. I want us to be body positive. The reason why is because there are kids who are getting sexually assaulted who don't have the language to talk about their bodies because the idea has been don't tell kids about that. Maybe they won't understand it. I've also seen an increase in teen pregnancy because, again, people think, hey, if we don't talk about it, it's not going to happen. But the thing is, it is happening. So if you don't feel comfortable talking to your child about what's normal, then bring them to your pediatrician or somebody who can talk to them about their body. Okay, because this is all normal, right? We're human beings. We're here to really have other human beings. So this is a normal progression in development. And kids have to know that this is normal as well. You may also notice that kids at this age have more arguments with their parents. So, especially as a parent, if you set ground rules, you told the teen you're supposed to be home at this time, now they're going to start pushing back. So they may say, okay, curfew's at 10. Why? Why do I have to be home at 10? I don't understand that. Or you make a rule, I don't understand that. I don't like that. A lot of parents at this time lose their minds because they don't understand why everything has to constantly be questioned, why the teen's always pushing. This is just a natural progression in the teen, like working towards independence. So what I always say to my parents at this age who are frazzled and tired, I get it. What you have to do is really sit down with your teen. Let's say if it's something about curfew, find a compromise. Okay, what do you want? You have to ask the teen what they want. What do you want to see? Let's say they say 12, and you say no, 10:05. Reach some sort of compromise. But if you don't compromise, you're saying that you're not really seeing your teen and you're not really respecting the teen. So at the same time, you want to hold those ground rules, but you want to say that you're seeing your middle adolescent as progressing to an adult and you're respecting them. I can tell you it will come back tenfold to you as your teen will start having more respect for you too as a parent. They may not say it, but they'll definitely appreciate it. At this time, teens may also spend less time with family and again more with friends and seek that validation and sort of kind of isolate themselves. All right, now we reach late adolescence. So generally, teens at this age have more impulse control. That frontal lobe is starting to form a little bit more. They're making hopefully better decisions that you can see, right? This may also be harder though because, again, they're a little bit more adult, and so they're becoming much more independent. So it's kind of harder to gauge as a parent. You're just kind of having to watch and wait. They may be better able to gauge risks and rewards, so they kind of know if I do something, this is likely the consequence. They have a definite stronger sense of their own individuality, which means that even though you've raised your child a certain way, you may be shocked if all of a sudden they have different ideals, and that they're very strong in those ideals. But this is normal. And again, your teen or your late adolescent may become more focused on their future and base decisions on their hopes and ideals. So they start thinking about their dreams, the rubber's starting to meet the road for adulthood, and they're ready to go. Friendships and romantic relationships should become more stable. If they do not, again, that's more of a red flag for depression and anxiety than something else. So I want you to at least hear that. They become more emotionally and physically separated from their family. They may move away or they may move into an apartment, but they, are starting to get jobs, go to college, hopefully do whatever they need to do to really accomplish their dreams. And now many reestablish an adult relationship with their parents. And what does that mean? So before, when they're looking at their parent as an authority figure, now they're not looking at their parents that way. They're kind of coming back, discussing, and talking to parents. This is also hard because, again, for parents and kids, they're redefining those roles. So and many parents have a hard time. I have mothers who are coming in with 20-year-olds and they're trying to tell me their schedules and how they eat. That's fine, but I need your 20-year-old to tell me how they eat and what they do, because they're leading their own lives, right? So it's a way for parents and teens or late adolescents to renegotiate that relationship. And it's not easy, but it's necessary for that adolescent growth and progression. So now we're going to go through signs of depression. So first off, changes in mood, right? And I know that you're thinking for adolescents, changes in mood, that's, the foundation. Teens are moody, and this makes sense. But this is more persistent sadness where they're irritable or they'll become hopeless. So this is where instead of the teen I normally say teens have like a rubber band effect. So they may be close to the family and then distancing themselves. Now they're just kind of staying away from the family. They're sad. They may say things like, I hate my life. I want to die. The thing that I do want to say about this is during the pandemic, I had parents calling me with 7-year-olds saying this and laughing, thinking that it was a joke. Anytime a child, I have seen kids as young as 5 in my office saying that they want to die. You have to take it seriously. It's never a joke. A loss of interest. So you may find that a child that was, or a teen who was once active in sports, who had friends and everything, just starts not wanting to do anything. A lot of times when I talk to my teens and I'm doing screenings, it's not necessarily sadness. They're just kind of meh. Well, how do you feel about life? I'm here. So you just want to kind of gauge that. There should at least still be those extremes, right? You should have happiness, sadness, but if they're just kind of apathetic, no real expression, that's also a red flag as well. The changes in weight can be kids overeating or it could be kids undereating. So either way, you want to just kind of monitor that. A child that normally, that gained 15 to 20 to 50 pounds in a year. You just want to mark them and see what's kind of going on. Or if they're just not eating, they're really just eating like one meal a day, then you want to kind of talk to your child about that. And also difficulty concentrating. And sometimes difficulty concentrating can mask itself. So parents think that it's ADHD. So they'll say, my teen was an A student or a B student, and all of a sudden now they're failing. They're not paying attention in class. So Dr. Bailey, I need you to diagnose them with ADHD. Let's get this checked out. The first thing that I think about is depression and anxiety. And as a health professional, I'm going to screen for depression and anxiety first before we move into ADHD, because those are red flags. You'll also notice that kids have fatigue as well. Now, again, I have a lot of girls who are having anemia and again, it can be tiring being a teen, but this would be listlessness, like just sitting all day on the couch. Or you also have teens who sleep all day. This is good for their development, but they have to have kind of some pep in their step at some time. So if you're noticing that they're sleeping all the time, that's a red flag. And again, thoughts of suicide and self-harm. Also, withdrawal from social interaction. So again, if you have teens who are constantly with friends and all of a sudden they're not engaging with their friends, that's also important as well. So in perspectives and treatment, you want to offer communication and support. What this means is that you want an open and non-judgmental communication with teens. This means that listening is key. If your teen is talking about something, listen. If you ask them a question, give them the time to respond. A lot of times I have parents who are just talking. And they're like, why aren't you answering? Why aren't you responding? Why aren't you doing this? Listen to your child and give them that time so that they can respond. They will appreciate you more, and that will build more trust. Offer reassurance and emotional support. And then at the same time, like I said, it's hard. I always say it's almost like having a like a dead phone line on the other side of a phone conversation. You're always trying to give that support. Maybe your child will respond back with an I love you every now and then, maybe not. But either way, kids hear it regardless. And you always want to provide a safe space for teens to express themselves. If you are noticing signs of depression, like we talked about before, you want to consult with a healthcare professional, whether it be a therapist, a school counselor, or a pediatrician, but please let somebody know. And then you want to explore various treatment options so that should that child be diagnosed with depression. And that would include medication, it could include therapy. I will say if you have a child who has told you that they considered suicide, who has a plan, do not hesitate to send them to Appalachia. Do not hesitate to send them to TMH behavioral inpatient. A lot of patients or parents are hesitant. They don't want to be judged, but you want your child to be alive. So please listen to what they have to say and do what you need to do. These are local resources in the community. You can always call 211. And again, they offer mental health services and mental health screening, and that's for adolescents and youth. You also have the National 988 Suicide and Crisis Helpline, just so that's available. And a lot of teams like the crisis text line. They don't want to necessarily call, but texting is a way for them to at least, even in some cases, be around their family who may not know, right, that they're depressed and still be able to contact and talk to somebody. In terms of creating a supportive environment, you want to collaborate with schools. So that means talking to teachers and educators to build that environment for kids to feel comfortable, talk to their peers. But essentially, this is an epidemic. So it's more often than not, we're seeing many, many more teens battling depression. You have to listen and you have to help treat. And having parental involvement as well in that supportive environment really helps bring the community in. The other thing I want to say about this is social media has been really prevalent. A lot of children and teens have been affected negatively by this. So creating a supportive environment also includes possibly limiting social media involvement. So again, a lot of times what happens, and I know you guys, a lot of you guys are younger, but kids nowadays will go to school, they'll have bullies, they'll have popular kids, not so popular kids. But with social media, what's happened is the environment from the school then comes home and follows them. So I've had episodes where a kid's been friends with somebody and then her friends post something, the whole school sees it, and then all of a sudden their lives have made a living hell. So you really do have to take that into account, how it follows teens and how it affects their lives. Finally, always encourage a healthy lifestyle. So regular physical activity, that helps boost endorphins. Adequate sleep, you want to make sure that they're getting enough sleep at night. Eating nutritious foods. So I always say when I talk to my teens, a lot of teens do not eat breakfast, and I always say that really helps. It doesn't have to be a big meal, just a small meal to help stabilize that blood sugar. And because they're growing, it helps give them energy and it will help keep their mood stable. And finally, you want to encourage teens to engage in activities, to be social, to build connection and community. So identifying and treating depression in teens requires a collaborative effort with parents, educators, healthcare professionals, and people in the community. And then by recognizing the signs of depression, the stages of adolescence, it really will help promote healthy lifestyle habits so we can help teens and preteens navigate their mental health challenges and thrive emotionally. I do want to say one thing. There are two phases of childhood development that I see that are very similar. In the first few years, you have toddlerhood, right? And that's 15 months to 3 years. Parents do not understand. They freak out because their baby, who had once been docile and listening and smiling, is now pushing against them, disobeying them. Teenage years are similar. I know teenage years go on longer, but you just have to give your teen grace and time. Keep giving them that positive reinforcement and they will appreciate it so much more. Even if they're pushing back against you, saying negative things, it's hard as a parent, but you just have to keep extending that olive branch and let your kids know that you love them and show up for your children. Great, thank you.